Human metapneumovirus, or HMPV for short, is a virus that can cause respiratory illnesses. It was first discovered in 2001, which makes it a relatively new virus compared to others we know about. Even though we've only known about it for a short time, HMPV has likely been making people sick for many years before it was officially identified. This virus primarily affects the respiratory system, which includes our lungs and airways. HMPV has a structure that is quite similar to another virus you might have heard of, called RSV, or respiratory syncytial virus. Both HMPV and RSV belong to a family of viruses called Paramyxoviridae. These viruses share some common features in how they look and how they infect our cells. One of the key similarities is that they both have an outer layer called an envelope, which helps them to enter and infect our cells. Because of the similarities between HMPV and RSV, scientists believe that understanding one virus can help us learn more about the other. This is important for developing effective treatments and vaccines for both of these respiratory viruses. Scientists and researchers are diligently studying HMPV to learn more about its behavior, how it spreads, and how it affects people of different ages and health backgrounds. HMPV is a global health concern, and it is found in many parts of the world, including India. The virus tends to be more active during certain times of the year, similar to how the flu season comes around. For HMPV, the peak season is typically during the late winter and early spring months. This is when we see more cases of HMPV infections. HMPV spreads from person to person through respiratory droplets, much like the common cold or the flu. When an infected person coughs or sneezes, tiny droplets containing the virus are released into the air. These droplets can then be inhaled by healthy individuals, leading to infection. The virus can also spread through direct contact with contaminated surfaces. For example, if an infected person touches their nose or mouth and then touches a doorknob, the virus can survive on that surface for a period of time. If a healthy person then touches that same doorknob and then touches their face, they can become infected. Certain groups of people are more vulnerable to severe HMPV infection. Infants and young children are at a higher risk because their immune systems are still developing. Older adults, especially those with underlying health conditions, are also more susceptible to complications from HMPV. People with weakened immune systems, such as those undergoing chemotherapy or living with HIV, are at an increased risk as well. Individuals with chronic respiratory conditions, such as asthma or chronic obstructive pulmonary disease, COPD, are more likely to experience severe symptoms if they contract HMPV. These individuals may require hospitalization or other medical interventions to manage their symptoms and prevent complications. The symptoms of HMPV infection can range from mild to severe, and in some cases, people may not experience any symptoms at all. Common symptoms of HMPV are similar to those of other respiratory infections, making it difficult to distinguish based on symptoms alone. Mild cases of HMPV often present with symptoms such as a runny nose, cough, sore throat, and fever. These symptoms typically resolve on their own with rest and home care. However, in some cases, HMPV infection can lead to more severe respiratory problems, especially in vulnerable populations. Severe HMPV infection can manifest as bronchiolitis, an inflammation of the small airways in the lungs, or pneumonia, an infection of the lungs themselves. These conditions can cause difficulty breathing, wheezing, and chest pain. In severe cases, hospitalization may be necessary to provide oxygen therapy or other supportive care. Diagnosing HMPV infection requires laboratory testing, as its symptoms mimic other respiratory illnesses. The most common test used to diagnose HMPV is a polymerase chain reaction, PCR test, which detects the genetic material of the virus in a sample collected from the nose or throat. Currently, there is no specific antiviral treatment available for HMPV infection. Treatment focuses on relieving symptoms and supporting the body's natural healing process. Rest, fluids, and over-the-counter medications to reduce fever and relieve pain are often recommended. Prevention plays a crucial role in reducing the spread of HMPV. Good hygiene practices, such as frequent hand washing with soap and water, covering coughs and sneezes with a tissue or elbow, and avoiding close contact with sick individuals are essential. Disinfecting frequently touched surfaces can also help to reduce the risk of transmission. Researchers are actively working to develop a vaccine for HMPV. Several vaccine candidates are currently in different stages of clinical trials. These vaccines aim to stimulate the body's immune system to produce antibodies against HMPV, providing protection against future infections. HMPV is a significant public health concern, particularly for young children, older adults, and individuals with weakened immune systems. While there is no specific treatment or vaccine currently available, understanding the virus's transmission, symptoms, and prevention strategies is crucial for minimizing its impact. As research progresses, we can hope for the development of effective vaccines and treatments to combat this respiratory threat. For more information on HMPV, please visit the website of the Ministry of Health and Family Welfare or consult with your healthcare provider.